Hi all, my name is Fletcher Havilar. I'm recently hired on with Kitsumkalum as the Emergency Programs Coordinator. Charlene Webb and I are coming to you today to discuss this current worldwide pandemic and the COVID-19 response that's happening in BC. You'll probably be aware that on the 18th it was determined to be declared as a state of emergency within BC. So we're taking fairly drastic steps to try to keep ahead of it. We are essentially limiting people's activity within the community to a certain degree. So you'll notice that some of the businesses are limiting your access. These steps seem drastic. They are essential to kind of keep people safe. What we really need to do is minimize the opportunity for the disease to get transmitted. That way we'll be able to minimize the flow of people who are getting sick and ending up in hospital, and allow the hospital staff, other healthcare staff, to keep pace with the transmission of the disease. Really it comes down to all of us doing whatever we possibly can to keep ourselves clean, to avoid contact with each other as much as possible, and to really limit how much contact we have in the community.
Thank you, and welcome.
Thanks.
He entered in at the big bang, I would say. So Kitsumkalum, to the community and to members who live abroad, please feel free to call our health center with any questions you may have. If you're concerned about family members that you'd like us to check on, 250-635-6172. My cell phone number is 250-641-1553. We're asking the community members to help us help you by slowing this down. By slowing this down, as Fletcher said, we are limiting visits to the offices to keep us all safe. If and when the pandemic hits the terrace area in Kitsumkalum, we have some measures in place that will help keep you safe and help you with your family. We've been notified by Northern Health that they can do screening, but you need to call the hospital ahead of time before you get there. If you come down with flu-like symptoms, we encourage you to call 811. It is a lengthy wait, but it's a wait worthwhile. Once they screen you, we're asking the community members to let us know, as Northern Health will not contact us. So as precautionary, we will be handing out some pamphlets today and this sign. We're asking community members to put this on your window, so when we do drive-bys your house, we can see that you're okay. Or if need be, a sign that says stop, and then we will know to call you to see if everything's okay. And then we are asking if you can identify this as a self-quarantine. If you can put this on the windows facing the road so the staff can see this. We will be driving around the community to ensure people are safe and these are the signs we will be looking for. If and when the pandemic hits in the community of Terrace, we have a small package that we would give to community members. It will look like this, only with confirmed cases. We will have an N95 mask, a blue gown for disposable, garbage bags, and gloves. When we have a confirmed case, this package will be delivered to your door. We will do daily check-ins with the community members. We will continue doing that until the pandemic has stopped. We are respecting people's safety and the staff's safety by doing daily check-ins. We encourage the membership. If you need medication and you have refills, to phone the local pharmacy. They will fill your prescription that you need. If you need new prescriptions and you don't have a family doctor, please call the HG clinic here in Terrace and they will accommodate. The doctor's offices here in Terrace are asking everybody to call in and reschedule any scheduled appointments they have. But for medication purposes and you don't have a family doctor, please call the HD clinic. They will help and accommodate you. For people needing adult Tylenol and children's Tylenol, those are covered under Blue Cross, and you need a doctor's prescription for them. And for the children, Pedialyte is also covered. We recognize it is still flu season, so therefore the children still could possibly get the flu. Rest assured that these things are covered, and you can access these through a prescription. And the Park Avenue Shoppers is asking people to phone ahead of time before they come to pick up their medication. So they're controlling who enters into the store and how much time we spend in there. So I'm asking you all to stay safe, check on each other. We will be doing daily check-ins with all our community members, and more so if we have a confirmed case in community. Thank you for your support, and blessings for everybody. Thank you.
Just a couple final points to alleviate fears, to let you know what you're up against. This disease is not airborne. It is contact precautions. So it's really important to keep all those surfaces and touch points in our hands and faces really clean. But if you're walking around, you don't really need to worry too much about getting it, but we really do need to limit our interactions so that we don't spread it. Frequent hand washing is the best way to go. Soap and water is the best medicine for getting it off of your hands. Really just take this seriously, be clean, be safe, and wherever possible, help your neighbors and community members out by limiting their interactions. So if somebody doesn't have a vehicle, help them get groceries, keep them off of public transit. Really try to keep our movements as limited as possible over the next few weeks here. Thanks for your time.
Thank you.